Order. Dame Priti Patel to move the motion.
I beg to move that this House has considered health and wellbeing services in Essex. I'm grateful, Mr Henderson, for you to be chairing this debate. And I'm really pleased to see that my right honourable friend, the member for Pendle, is the Minister responding. And he's been very, very good on many issues that I have taken to him thus far. Mr Henderson, I will be covering a wide and diverse range of health-related issues affecting my constituents and those across Essex, and appreciate that some of these issues will fall outside of the Minister's portfolio, but I know that he will take them on board and obviously feed back to other colleagues. He's an excellent Minister, and I know he will respond in a helpful way. And I'm particularly pleased to welcome to this debate the right honourable colleagues from my neighbouring constituencies, in particular from Malden and from Colchester, because we care about the provision and the quality of health and wellbeing services. It's important to our constituents, and Mr Henderson, I think it's important that our constituents know that we will work together as neighbouring MPs on some of these issues. As the Minister and colleagues will be aware, just over a year ago, it was March 2023, I think we were in this very chamber having a similar debate with a similar title. I think we stretched it to the east of England last time round, and this debate follows on very much from that one. Everyone here will know that Essex is an amazing county. Our residents, businesses and communities are hardworking, resilient, entrepreneurial. They're ambitious, aspirational. They obviously back all the Conservative values around lower taxes and as being a county of entrepreneur and the engine of economic growth. We are net contributors to the Exchequer, Mr Henderson, and I never tire from saying that, because as net contributors to the Exchequer, we in Essex do not always get our pound of flesh back from the Exchequer when it comes to the investment in our public services. So I think it's fair to say our constituents expect that from the Exchequer, particularly that we are supported when it comes to our public services, including the NHS, but also wider health and wellbeing services that do not always require medical interventions or diagnostics. Part of our county, and I think it's fair to say, in mid-Essex in particular, has experienced considerable levels of growth in the population and demographic changes. And that does cover the constituencies of Colchester and Malden. And just for clarification, we share district boundaries, so our council boundaries are intertwined. We are effectively three integrated MPs, I think it's fair to say, on to many of the issues that we stand up and speak for. But those living within Essex County Council's boundary now total more than 1.5 million, and that was at the 2021 census. That's up by more than 100,000 people on the 2011 census, which is more than 7% and above England's average. And England's average at the time was 6.6%. That includes areas such as Southend, Thurrock. So when we include those areas, our county population totals just under 2 million, actually, at 1.9 million. So we're one of the fastest growing counties in the country. Growth in the city of Colchester, which covers parts of my constituency, continues to grow. And with that, of course, demand on public services continues to grow. And we are seeing as well that under that census, we have over 300,000 people now aged 65 or over. That's 21% of our population. That's higher than the average in England. The average in England is 18.6%. And by 2035, that number will grow by up to 27%. So that is just under 400,000 people in Essex. While those aged over 85 will rise by 60%. So you can see, Mr Henderson, our numbers are growing. We are also an ageing, not just county, but country. And that obviously, by contrast, impacts on the working age populations, that's 18 to 65, which is set to rise by only 4%. So you can see the counter-cyclical issues that we are seeing here, resulting in the fact that a greater part of our population will be elderly. And with that ageing population, you know, we are, interestingly enough, seeing increasing numbers of young families coming to Essex. That means more house building. Our schools are good where we are. They're good and outstanding. and we're all commutable territory as well. Our towns are thriving and growing. So as I debated last year, we've got pressures on social care, which effectively have a very significant impact around health and social care systems, the integrated care systems that have been introduced. We've got further integration taking place. But in particular, when it comes to spending at county level and district level and city council level as well. We have a number of ICBs that cover Essex, NHS Hertfordshire and West Essex, NHS Mid and South Essex, which predominantly covers the Mid-Essex part. Then we have Suffolk and North East Essex covering Colchester and Tenderyn, and a number of hospitals as well. The biggest are Broomfield, Colchester, the Princess Alexandra, Basildon and Southend. And our emergency services are the East of England Ambulance Service Trust, and we have the Essex Partnership University NHS Foundation Trust, which provides mental health services, and I'm going to come on to those areas and those trusts in particular shortly. So, as you can see, we have a range of trusts, hospitals, challenges. It's fair to say when I was first elected, we had the old-fashioned PCTs and strategic health authorities. They were deeply unpopular, they were hugely problematic, they were massively resource-intensive and hugely bureaucratic. So the changes and structures we have now seen provide greater integration. But really what matters to all our constituents and residents across Essex is not so much the configuration and structures, but it's how these services work together effectively to deliver what they and their families need. So that's primary care, appointments, access to health services. So there is, I will absolutely give way.
Obviously, the debate is very clearly about health services in Essex, so therefore it's not to do with Strangford. But just to support the Honourable Lady and add my support to what she's outlined the problems that there are in Essex, and I have to say that they're replicated across my constituency as well, whether it be the closure of the minor injuries unit, which is integral for the local community. Constituents have to travel further to get their health care, the very things the Right Honourable Lady is referring to. So does the Right Honourable Lady agree that health bodies must be focusing more on community health and well-being to ensure that all constituents have the local access they deserve to efficient health and care services? And again, I commend her.
Oh, I thank
Dame Priti Patel.
He's absolutely right. And if I may say so, Mr. Henderson, my honourable friend actually has teed up the issue that I want to discuss and raise, because it is about community healthcare provision and localised services. While I've just mentioned our big hospitals, it is absolutely vital that we have localised healthcare provision, which brings me on to a local issue that affects my right honourable friend, the member for Malden, and myself, which is the issue of the future of St Peter's Hospital, which I raised in the House last week at Health Questions, and my right honourable friend, the member for Malden, has also secured an adjournment debate for further discussion in this area on Thursday. Last night, I attended a public meeting hosted and organised in Witham Town by Witham Town Council, and I know colleagues will say more about this during the debate, but to put this issue into context, my right honourable friend and I are receiving, to say hefty mailbags is an understatement, unprecedented levels of correspondence and communications, emails and phone calls, from both concerned and angry residents who are frustrated by the plans put forward by the Integrated Care Board to remove services from St Peter's Hospital that could, and effectively the consultation that has been proposed, could lead to the closure of the hospital. The Minister will know these plans are subject to consultation, and my right honourable friend, the member for Malden, and I are actually calling for that consultation to be extended, and it has been extended. We were given that clarification yesterday. But the services that we are discussing include the removal of stroke rehabilitation in patient beds to Brentford and Romford. These are not local areas at all. These require considerable travel. Making permanent the temporary removal of a midwife-led birthing unit, and seeking the views of the future removal of other services from the site, which include outpatient services covering blood tests, ultrasound scans, x-rays, podiatry clinics, and the services to support mental health patients, totaling on average around 300 patients a day using this particular site. I should add, this site is a much-loved community site, And I think it's fair to say, generationally as well, everyone within our districts would have been touched with some kind of interaction and engagement. I myself have been a user of St Peter's, the maternity facilities, and if I may, I met the maternity nurses there last night who kindly came to our public debate. They are remarkable ladies, and they're just wonderful in the care and compassion that they give. Mothers, and new mothers in particular, who quite frankly do struggle, you know, after the birth of their first child, to adapt to some of the post-maternity services, and these nurses are wonderful. The hospital serves the town of Maldon, but actually the wider rural area, and including constituents in Maldon district that come under the Witham constituency as well. And what's more is that this part of Essex has experienced very, very considerable economic growth, and by that I mean housing growth in particular. We have, both our constituents, the Right Honourable Member for Maldon and I, we can't even speak about small housing developments. We have significant housing developments, and I'm just going to refer to Westcombe Park development in Heybridge, which straddles both our constituencies. That's a development of over 1,000 homes. And that really speaks about the type of developments that we have locally. The current local plan is running up to 2029, and we will see the development of another 5,000 homes. And recognising that we need more homes, people need homes to live in, we aspire to own our homes, we need to know that new housing and population growth will actually have the infrastructure and public services that will support that in the long run. So this consultation for St Peter's is very important. The document itself covers a range of issues, but I have to say that it's not acceptable for us now to just say it's fine for the services to go elsewhere and be relocated. Our constituents will experience considerable travel times, and there are issues with local public transport as well. I'm afraid to say trying to park a car at Broomfield Hospital is now impossible. So we want to see these services remain locally. I think that's absolutely pivotal. Importantly, within the town of Maldon district itself, our constituents have serious reservations about these proposals, and I think it's right that we, as local MPs, continue to support and champion and work with the Integrated Care Board and the local authorities and with ministers and the government to secure these services in Maldon town itself. We have to keep these services in our district. So I know the Minister can't specifically intervene around matters being considered by the ICB, but I would welcome his views, and I think this is going to be very important going forward. I think this consultation also sets a benchmark in terms of engagement with ICBs and future-proofing localised healthcare services, which we all want to see across our constituencies. I've mentioned enhancing the services and safeguarding services in Maldon itself and the Maldon district. The department is very familiar with communication around Witham town, and my calls over 14 years for a new health centre in Witham town. My correspondence file is large in the department, I know that, and I thank the forbearance of ministers for all the responses that they've sent me. But like Maldon, Witham itself has had huge amounts of growth in housing, which means that the demand on primary care is outstripping supply. We have 4 GP practices in the town itself. I'm going to name them all. Fernhouse Surgery has 16,500 patients. Douglas Grove Surgery, 6,500. Witham Practice, 6,500. Collingwood Practice, which I visited recently, 2,500. That's a patient list of around 32,000, just in the town itself. The national patient GP ratio average is around 1,700 patients per GP, but across these 4 surgeries, there are around 13 full-time equivalent GPs, basically meaning that the patient GP ratio is close to 2,500. That is the tense situation that we have and the challenges we have. Recognising as well, we have the incredible Anglia-Ruskin medical facility. Many of us were part of the business case for that, and we're very proud of that. September last year was the first cohort of medical practitioners that came out of them. We're desperate to make sure that we keep them all local. We absolutely want them local. But the reality is we should just discuss the practicalities of how hard it is to get a GP appointment. So with that, of course, that's why we need new facilities, more support for GPs, more primary care staff to improve health services in Witham. I'm consistent in my campaign for that. I'd like to pay tribute to Braintree District Council, who've been on this journey with us. We do have capital funding for a service, but the Minister will recognise that we need the GP practices to come together, in particular to put the business case as to how they can all work together. I do want to pay tribute to the work of the local ICB and the Alliance Director for Mid-Essex, Dan Doherty, who has undertaken to pursue this project with local councillors. And I have to say, I feel for the first time in a decade, we have better collaboration and a stronger commitment to making this happen. We have opportunities to redevelop locations. I can't speak about those locations. Some are commercially sensitive and they're subject to local councils and the ICB right now working together. But we do need the critical mass of our GPs to firmly commit to driving this proposal forward. The Minister will know it can't be achieved without them. And we want to ensure that, there is sustainability for them and a future business for them where we are protecting, for example, prescribing, because one of these practices it's a prescribing pharmacy, so it's important that we give them the approach to do this. I have to say, with the whole game-changing dialogue that we see in government now about localised health services, community pharmacies, the Chancellor's focus on improving efficiency in the NHS, if we can pull these strands together and knit them together, this could develop and lead to great outcomes, I believe, for Witham Town. The frustration of my constituents in Witham Town is palpable. They've been waiting decades for this. We must, as a government, deliver for them, and I will continue to press the government on this. In addition to the growing demands in Witham, we have the growing demand for primary care and GP services in other parts of my constituency. I'm going to name them. These are theoretically villages, but the growth basically means that they do not fit the old analogy of what a village used to look like. Villages such as Kelvedon and Fearing, Stanway in its own right is no longer a village. It is now becoming a town within the Colchester city footprint. And the beautiful village of Tiptree, which is pretty famous for Wilkin & Sons and some wonderful businesses as well. The Tiptree Medical Centre now has 12,000 patients on its books, and there are concerns that there are too many for one practice to handle. In recent days, I have received a letter from the practice explaining that their clinical rooms are full to capacity and that they may be considering options to close their patient list or to new patients, either on a formal or informal basis, and to significantly reduce their patient catchment area, so not to include patients who are registered in the CM postcode area. This is worrying, if I may say so, and it is deeply concerning. Action is needed to address the concerns about the impact of population growth. This is, of course, something our local authorities should be doing as they develop their local plans and be much more strategic. But 6 years ago, a very unpopular planning application was submitted for 200 dwellings in Tiptree, which was widely opposed, including on the basis of pressures on the local health services, so on Tiptree medical practice in particular. The application did, however, initially put land aside for a new medical facility. Despite local opposition, the application was granted on appeal. However, no site for a medical facility was included in the end, as according to the decision issued. And that decision issued said that the application originally included the provision for land for a medical facility, but this was removed from the proposal. This is because Tiptree Medical Centre and North East Essex Clinical Commissioning Group, the CCG, no longer required the land on the site and instead requested a financial contribution towards the provision of medical facilities. This contribution has been incorporated into the 106 agreement. But as we can see from the correspondence that I've referred to from the medical practice, the new capacity is now not sufficient. So what we now have in Tiptree is an unwelcome development, a growing population, but no significant new investment to meet the demands. And again, across Essex, planning contributions to health facilities are just inadequate, and they are not delivering on the improvements that have been promised. This is totally unsustainable. I would like the Minister to review this and the Department to review this and in particular look into the provision of GP services in Tiptree and with the CCG to look at how developer contributions are secured and issued. Now, as well as protecting and enhancing primary care facilities, of course, we do need to talk about the issue of GP training. I've already mentioned Anglia Ruskin University, and, you know, we are thrilled with this facility that we have. And I know the Minister himself, I think the Minister may have visited recently, and, you know, I'll be heading there as well this week. It's an incredible facility, and we do need to grow that facility at some stage, which basically I'm hinting already to the Minister, that means expansion of the facility, and then we can grow capacity and have more locally trained medical practitioners. But on the subject of healthcare in our community, I do want to thank the Minister and the government for empowering pharmacies to deliver more services. This is long overdue. I've raised this in previous debates and spoke when we had the announcement in January that pharmacies can now support patients with 7 common conditions. This reportedly frees up something like 10 million GP appointments per year. That's incredible, while providing pharmacies with new business activities and, importantly, keeps that footfall going, because our local pharmacies are at the heart of our communities. And I think it's fair to say for all honourable and right honourable members in this debate today, knowing our geography as I do, and we all do, particularly with the right honourable member from Alden, where we touch the coast, this is absolutely pivotal, it really is. So I would urge the Minister to look to consider empowering pharmacies by giving them the opportunity to grow that provision around the wider conditions that they can treat. I'm a great believer in social prescribing as well, and some of these pharmacies could utilise their own buildings to even have social prescribing hubs as well, which I think is something that we should all collectively expand and look at too. So the Minister's heard me touch on about the importance of investment in primary care services, but he will also recognise from the statistics that I referred to in my opening remarks, the importance of prevention and social care services. Essex County Council, I have to say, I think we're blessed with the calibre of leadership that we have there. We have the County Council led by Kevin Bentley and County Councillor Sir John Spence, the portfolio holder for health, adult social care and ICS integration, have got a strong record in supporting investment and service area improvements. I don't say that too lightly because we weren't there a decade ago. And with that, the infamous term that we none of us like to raise and say of bed blocking would take place in our hospitals. And of course, we know the implications of all of that. But at any one time, the council is supporting around 16,000 people with social care and 40,000 during the course of the year. Over 90% of people who use their services say that they are safe and secure. The council is supporting an increase in numbers with hospital discharges and re-enablement services. And I visited actually an organisation called MediEquip on Friday, based in Braintree District, that are contracted by Essex County Council. And the innovation and the quality of care and equipment that they are providing with re-enablement services is phenomenal. And I think we have to do much more to support this. We really do. The Essex Wellbeing Service has helped 73% of people in Essex to quit smoking, for example. So, you know, these are important interventions because it's preventative care. And also it supported the provision of 42,000 NHS health checks. We need to do much more on the health checks, and in particular around cancer and cancer checks as well. I won't go on the numbers that I mentioned earlier on around the elderly population, but the population also with learning disabilities and autism is also increasing. It's expected to grow by 3% by 2025. That's just around the corner. That's next year. And the population with working-aged adults with sensory impairments will grow by 5%. The council is spending around £500 million a year on adult social care services and around just over 200 million on people aged over 65. And just under 300 million on working-age adults. So again, that's age between 18 and 64. I welcome the funding that we have, but we definitely need to have much more. And with that, I know I met parents yesterday while in the constituency who are fighting for education, health and care plans, which is common for all of us now. Very difficult areas. Since 2019, under Essex County Council, the numbers have increased from just under 9,000 to over 11,600 in 2023. That's a 29% increase in 4 years. Essex is doing very well in this compared to many authorities, but I have to say we are struggling to get these plans for children, and it is a ongoing, long-standing issue. And I think the Minister will recognise that we're seeing greater demand from parents, and schools themselves are raising this issue. Another area of frontline health provision, which will be familiar to the Minister, is dentistry. And in the east of England in particular, this isn't just Essex, we have long-standing problems, and the House of Commons Library has shown in Essex that in 2023, around 52.2% of children in Essex has seen a dentist in the last 2 years, and that's just under the English average of 53%. Our figures are not good, and we need to know, and I'd like to hear from the Minister, how we're going to tackle progress in this particular area. I would like to just touch on the mental health statutory inquiry and thank the Minister for the time he gave us last week to meet to discuss this, and colleagues in Essex are familiar with the concerns over this whole issue. When we were debating health and wellbeing services last year, the inquiry was on a non-statutory footing, and it was established back in 2021 to investigate 2,000 inpatient deaths that had occurred since 2000. I want to pay tribute to Geraldine Strathsey for her work in chairing that inquiry and for doing all she could to see the evidence and the witnesses that participated in that work. She, families and colleagues in this place were frustrated that not enough progress was being made, and importantly, not enough evidence was coming forward. Colleagues here, all colleagues, pressed for the inquiry to be converted to a statutory inquiry. And we now have Baroness Kate Lampard to chair that inquiry. Over the last few months, she's been consulting on the terms of reference, and I want to thank Kate for that work that she is doing. Obviously, the Minister is familiar. We're waiting for the terms of reference to be finalised. Our constituents, I have to say, have been incredible in their dignity, their courage and bravery, but also their resilience. As human beings, they have been through a terrible ordeal. They really have. They want to see the statutory inquiry now progress at pace. I just want to pay tribute to my constituent, Melanie Leahy, whose son Matthew died in 2012 while as a patient in the Linden Centres. She is the lady, if I may say so, and my right honourable friend, the member for Malden, will speak to this as well, as she was at one stage his constituent too. Remarkable for, I think, the way in which she is absolutely tackled what I call publicly institutional state failure in terms of how her son was treated, but importantly, helping to get a statutory inquiry, and I pay tribute to her. They must all get the answers that they need and lessons learned from what is happening. And we owe it to those lives that have been lost and their families to work to absolutely change the system, but for them to get answers. And I look forward to the Minister's comments, particularly in this area, and how we will come together to make time to meet some of the families as well, and work with them too. Mr. Henderson, my final comments that I just want to touch on really speak to the future of the NHS, workforce plan, growing demand in services, and just also the work that's taking place in our hospitals and NHS around recruitment. My last dialogue with the Chief Exec of Broomfield Hospital, and I'm interested in this, and I ask the questions all the time. The House has heard the numbers and the statistics I put forward, how difficult it is to get an appointment, how pressed we are on medical practitioners. I think we should also just recognise we have an incredible international workforce locally, we really do. Our NHS would be in a much harder, difficult position if it was not for the staff from Botswana, India, Pakistan, Nigeria, Nepal, Sudan, India and Egypt that are working in our health and social care services and contributing to our public services, our economy and to our tax system. They are caring for elderly and vulnerable residents across our constituencies, and they should be thanked for doing that. There have been some interesting debates when it comes to migration and immigration, and also the skills of those coming to our country and their contributions, while, of course, the need to control numbers. But we have to recognise that is because of workforce pressures, that we have not done enough ourselves as an economy and a country to do more to grow the skill sets here. I want to encourage the Minister to ensure that as part of the NHS long-term workforce plan, we do much more. We've got AIU, there are other universities across the country as well, that we absolutely do more. But what I do want to see happen from this government is the recognition that we need a wider labour market strategy which must address these issues and sometimes unnecessarily inflamed debates around immigration, but also recognise the fact that those that come to our country on a skilled worker route, they pay thousands of pounds, many of them, not just in the NHS, and if I may, just outside of the NHS, for immigration health surcharges, which actually contribute to the finances of the NHS. Many of them are high-rate taxpayers, and they contribute to our economy and to our country and to these important sectors. And with that, of course, technology has a role to play. It really does. We can do so much more through technology, and we must make sure that we can absolutely grow the workforce locally going forward. I have presented the Minister with a long list of health and wellbeing issues across Essex. I want to thank him and his team for their patience. I know the Minister he's a great considered Minister. He will respond accordingly. But I just think it's fair to say, with investment, innovation and support, our health and wellbeing services across Essex could be so much better and could improve. And importantly, they would meet the needs of our constituents and ensure that we have not just a sustained NHS service that meets the needs of our population, but also that we would have a happier and healthier population. Thank you.